Hi, this is task one, preparing the the anesthetic machine. And we are checking the oxygen source to verify that there is enough oxygen in the tank for the entire procedure. And right back here, it says that our oxygen tank is full. So we are going to go upstairs and check and hook up the rest of the anesthetic machine and verify that everything there is functioning properly. Alright, so now I'm going to hook up the anesthetic machine, and we're going to plug in the oxygen, turn on the scavenger, and go over here, and I'm going to turn on the oxygen, make sure that my marker goes up to where it's supposed to be. Turn that back off, and the soda lime canister looks like it is good and it does not need to be changed. We use isoflurane for the anesthetic, and can't see it from there, but it is almost halfway full, so there's plenty to make it through the procedure. Our patient is about 14 kgs, so we are going to use a 2 ml reservoir bag. Let's see. So we have everything appears to all be connected well. Then we are going to do the low pressure test to make sure we don't have any leaks in our system. And we're going to hold the bottom here, close the pop-off valve, turn the oxygen up, about 3 mils. Filling up our bag. It's gotten really full. Take this down to about 3, get it down to 30. Move it down a little bit. And the pressure stayed. Instead of 30, it was actually up to about 40. But we will shut this off, and then open our pop-off valve, and it is ready for our patient. This is task 2. We are going to do an orthopedic procedure on a boxer, and we have performed the physical exam, and we have done the blood work and lab tests and got all those results a few days ago. I have discussed with Dr. Boyer the pre-anesthetic medication, and we are going to use atropine, acepromazine, and butorphanol. The atropine dose that he likes to use is 1 ml per 20 pounds. Our patient is 44.1 pounds. So we're going to take 44.1 divided by 20, and gives us 2.205. And so we are going to give her 2.2 mils of atropine. Acepromazine, he likes to use 0.1 mils per 20 pounds. And so that gives us, if we do 44.1 again, divided by 20, and then multiply that by 0.1. We will be giving her 0.22 mils of ace-promazine. Butorphanol is, he likes to use 0.15 mils per 10 pounds. So we'll take the 44.1 again, divide it by 10 this time, and gives us 4.41, and then we'll multiply that by 0.15. So we will be giving her 0.66 mils. It'll be either 0.6 or 0.7. Dr. Boyer will make that decision, and we'll get that drawn up, and I will confirm those doses with him. Okay, so the dosage that we decided to do for the atropine is 2.1 mils, the ACE is 0.2 mils, and the butorphanol is 0.7 mils, so it fits into a 3 mil syringe. So we are doing an IM injection in the quadricep muscle, and so I have verified that the dosage is correct for her pre-medication, and so I'm going to in here, clean the area, take off the needle off the syringe, and inject the medication, aspirate, and now we're going to wait 15 minutes and put her in her cage to monitor her. So after monitoring the patient for about 15 minutes after giving her her pre-meds before surgery, we took her into surgery, and I was unable to videotape the end of me monitoring her because from my position I was unable to get to the video camera. But she was monitored for about 15 minutes. Afterwards we put in her IV and took her to surgery. This is task 3, and we are going to set up all the supplies and everything for a procedure that we're doing this morning. I'm going to start over here. This is where we will put in the trach tube and the induction stuff. So we'll put this here for padding, and put the blanket or put some towels down for more cushion. And I have this towel to cover her so she does not get cold. And we have our trach tubes. We went ahead and grabbed 3 different sizes, and we will get the syringe to check the cuffs to make sure they all work properly. One does. I'm going to set them out of the way for the moment, and we'll we went ahead and did an 8, an 8.5, and a 9. And our syringe will be over here and on our oxygen our anesthetic machine. We have the eye lube to put in the dog's eyes. Our flow rate for the oxygen will be for induction. It'll be 3 liters per minute. During recovery, it'll be 3 liters per minute. For maintenance, I figured that, which the formula for it is somewhere between 25 to 50 milliliters per kg per minute. For the patient size, that ended up being about 0.4 to 0.8 liters per minute for maintenance, and that'll show up on there. We have our stethoscope on here to be ready for the technician, technician that's doing the anesthesia. And then we will go over here and get the IV catheter stuff ready. Also, to let them know and everyone know, the emergency drug supply list or box is in the surgery room on the shelf. And we'll come over here and get the IV stuff ready. So for her size, we always get 2 different sizes of catheters for the veterinarian, and we are going to use a regular T-port, an extension set, and a 60 drop set. Get a bag of lactated ringers. Sometimes the bags are kind of easier to load. We are going to put the extension set, everything together. Apparently we have a different type of extension set. Interesting. Make sure we clamp off the tube before we insert it in our bag. Let me get a longer. Thank you. We want to make sure this end does not come in contact with anything.
I'll be right back.
We want to fill this up to the line on the chamber. And our fluids. Make sure everything is open really well. Open. Let this run down. Flick it to remove any bubbles. Close it. Now our IV bag is ready. Get all this stuff out of the way and throw it in the trash. down here and get our catheter stuff set up. So we usually just use the lactated ringers for, instead of using heparinized saline. If you do use a heparinized saline, it's 5 units per mil of, 5 units of heparin per mil of saline. But we will just fill our syringe with lactated ringers. Going to flush our T-port. It off. Sit it there. And for our IV, we'll go, or catheter, we will go ahead and get it flushed. And I she will probably use a 20 gauge catheter, so we'll go ahead and flush that one. We have our flush. Here is our catheter. Need to get tape. We usually pull this tape about, depending on the size of the patient, not that big. And then we tear it to where it's about 1/3 or 1/3 and 2/3, and stick it on the table. And we do 2 more pieces about the same length, but don't tear them in half or thirds or whatever. Put them on the table. Couple of pieces of gauze, alcohol, cotton ball, Band-Aid with some iodine on it. Use a cotton swab to get it. Put a small amount on the pad of the Band-Aid. Set that there. Put this up. Let me grab the clippers, which are here. They're not where they normally are. And I got a 40 blade on there. And it feels like they have been freshly cleaned, so we will put that there. And I think that is all we need for our procedure. Oh, and the anesthesia record, which is in the other room with the veterinarian. And here is her paperwork, and I will get her anesthesia sheet ready and printed out for them. And I just realized that the mask for the oxygen induction was over here next to the clippers, so I am going to put it on the anesthetic machine. Okay, so this is surgical scrubbing. I have no jewelry on. My fingernails are cut short where you can't see them from the other side. I have no polish on. I have my brushes over here, my sterile brushes. They are not reusable ones, they're disposable. So I'm gonna wet my hands down, and I'm going to clean my underneath my nails first. First brush, and I'm going to scrub my fingertips 10 times, then all 4 sides of each finger 10 times, the back side of my hand 10 times, palm of my hand 10 times, all 4 sides of my arm, drop that brush and get another one. And repeat on the other arm. 10 times on my tips of my fingers. All 4 sides of my fingers. my hand. Palm of my hand. All four sides of my arm 10 times. Drop the brush, and I would repeat that procedure with the brushes 2 more times on each arm. And I'm going to rinse, making sure I don't touch anything and keeping my fingers above my elbow. I'm going to gown in. I'm going to first open the last flap and pick up my towel by the corner, shake it out, use one corner to dry my right hand, other corner, do my left, drop that, and I'm going to grab my gown, step over here out of the way. Make sure I don't hit anything. Shake my gown out. Put my arms in, making sure that I do not let my hands come out the end of it. And I'm going to turn around and let Cindy tie back of it. So I'm going to perform the gloving. I make sure my hands do not come out the end of my gown. And I'm going to grab the edge of my glove, touching as little as possible. I'm going to put thumb against thumb as I fold it over my hand. I'm going to try to work my fingers out of my gown. Which is quite difficult because my gown is about 4 sizes too big. Same with the other hand. Careful not to pull too much on the gloves to cause a tear. Pull that down. This hand to pull this down. Now I can work my fingers up into the gloves where they are supposed to be. Pull my down out off my hand a little bit more. And my gloves are on. So Cindy is going to come and finish tying my gown. There is scrubbing, gowning, and gloving. This is task 13, and before we got started, I wanted to show that our gowns are pre-packaged, sterile, and they don't get autoclaved, so there's no indicator and strip in there for us to show. We're opening gown for packaging. Now it's ready for the doctor to finish opening. Hi, my name is Misty Stouffer, and this is task 14, and I'm going to get the surgeon's gloves out, and she wears the powdered free size 6.5. Open it. This is task 17. I am going to wrap this pack for an orthopedic procedure. I will start by placing the indicator strip inside the pack. Here's the pack. I have my tape, Sharpie to put initials on, and the linen for the wraps. So I'm going to set this stuff out of the way. Just start by laying out the linen. Put my pack in the center. Fold it over. Make it as tight as possible. And then accordion. Continue to accordion these until there. And we want to hold this down. Do the side. Continue to accordion. Do the other side. Big one, the last side up. Make it as tight as possible. You want to fold it in. And have this flap turned out. Set this aside so I can lay down the next linen. Lay it out, get it all smooth. Place the pack on top. Repeat the process. Folding the sides over. Get the corners down as good as possible. And then tuck that in. Fold the flap down. And take our indicator tape. Write our initials, the date, and which pack it is. And now it is ready to be autoplayed.